Good day. My name is Sunday Mercy, 100 level healthcare management and nursing science. I'm a student of JPTS, Institute of Management, Science and Technology, in collaboration with South American University, America, Global Wealth University, Togo, Pan American College, California. I will be presenting a brief seminar paper on the topic, Sexuality and Contraceptive Use Among Adolescents. Now, adolescence. Adolescence is a critical period of development for young people that is usually marked by many psychological, physical, and social changes. This is by Ragnaka and Rajiv in 1999. This phase of life is also presented with fatal and life-threatening health risks due to risky behaviors. According to the World Health Organization, nearly 35% of the global burden of disease has its root in adolescents. Engaging in risky sexual behavior, for instance, is due to the fact that majority of these adolescents tend to assume independence, however, lack the information and self-confidence to make informed decisions about their sexuality. This is by Balance and Way in 1998. This risk is high and sexual behavior predisposes them to various reproductive health issues which majorly affect girls, such as early childbearing, sexual transmitted disease, which includes HIV, unsafe abortion, and maternal mortality. Contraceptives. These are a variety of modern contraceptive methods, such as pills, injectables, implants, and barrier method. The example of barrier methods, we have the condoms. These methods are proven to be highly effective compared to non-conventional traditional methods like withdrawal, rhymes, calendar method in prevention of unwanted pregnancies due to the low failure rates and minimal side effects. Despite their usefulness, contraceptive usage is generally low in most developing countries, including Nigeria. With high unmet need for family planning among sexually active women, it is estimated that contraceptive prevalence among women in Nigeria is 16%. Barriers associated with access to contraceptive among adolescents include discrimination, cost, inadequate knowledge, and societal pressure. Adolescents are victims of discriminatory reproductive health service provision, including contraceptive service. Services provided oftentimes do not provide this to adolescents. They don't give them adequate information and they are being restricted from access to mostly condoms due to personal bias against having premarital sex. Sexual activity and contraceptive use among adolescents. Low level of contraceptive use probably reflects the spontaneity of adolescent sexual activity and lack of knowledge, as well as the many barriers young people face when they attempt to obtain contraceptive protection. This is birth control in Nigeria. Use of natural family planning avoids some of these difficulties but require meticulous chart and a comprehension of female menstrual cycle the few young people poses. It is not surprising then that few adolescents use contraceptive and that many rely on friends for information and supply. The practice of discouraging young people from obtaining professional birth control education and service place them at an high increasing risk of pregnancy, STDs, including AIDS. Young people are not taught about contraceptive in Nigeria. However, for fear that this will encourage permissiveness, promiscuity, the policy leaves young people in an information vacuum. Now, let's talk about barriers and limitations of contraceptive use among adolescents. First, we have the timidity, the nonchalant attitude, and low self-esteem. Adolescents were reported to have low self-esteem, they lack confidence to seek contraceptive service, they were also perceived to be too shy to openly discuss contraceptions with health workers. Gender and cultural norms. Girls who seek contraceptive information and services are regarded to be wayward. This hinders them from acquiring available services in the public health center. We have the cultural and the religious norm. The cultural norm, this is unacceptable because it reduces the size and population. This is believed in the olden days. While the religious, they believe that contraception is immoral because it is unwise for an unmarried adolescent to acquire such because premarital sex is a taboo. Now, the merits of contraception among adolescents. This reduces pregnancy and related risks. It reduces the need for abortion. It can banish hormonal acne. Now, when you use contraceptions, it will help the adolescent not to go for unwanted abortions, which could end up taking the life of the mother or the baby. And it reduces the rate of having 13 to 19-year-old children getting pregnant. It reduces teenage pregnancies. It reduces the risks of ovarian and abdominal cancer and iron deficiency. It reduces the risks of ectopic pregnancies. This also means the carriage of the fetus outside the womb. Now, the demerits of contraceptive among adolescents. Some of these contraceptive pills do not prevent sexual transmitted infection. Some may cause weight gain, which is obesity, blood clotting. Oral contraceptive pill can increase the risk of developing blood clotting in the vein or the leg, and when it moves to the lung, it is high risk of losing the person's life. This is more prominent in people who smoke. We have cardiovascular diseases like high blood pressure, we have cancer. These are all roles that are being played, which causes the adolescents to be at risk. Now, in conclusion, the role played by community appointed teachers must now be assumed by government agencies, non-governmental organizations, church groups, parents group, and youth group. Although this is inevitable, these agencies and groups must work together to develop programs to deal with this issue facing today's youth. Teachers and parents should provide with the skill to socialize with their children on sexual matters. For teachers, this training can begin in colleges, while for parents, they can have it in teachers and parents forum, whereby these parents can be taught examples and roles on how they could lead their children. But this problem can be minimized by provision of appropriate adolescent reproductive health service. Now, my recommendation. Meet young women contraceptive need is a critical component of strategies to improve their children and eliminate poverty. Now, these agencies or governmental or people should be able to provide high quality contraceptive service that help young adolescents overcome the personal and cultural barriers they face by providing care and protection through their rights team. Religious leaders should take enjoyment to discuss about this among their youth and young fellow, and they should end child marriage and prevent rape, other type of coerced sex and sexual abuse. This violation of human rights. Thank you.